Hi, I'm Shari from CollegiateParent, writer and Facebook community manager. Thanks for joining us here today for COVID and the college student. Your questions answered. I, like you, am a parent. I am the parent of a current college junior as well as a graduate student. And I'm joined here today by Dr. Naomi Zilkha. Welcome.
Thank you.
Dr. Zilkha is a pediatrician with over 25 years of experience. She is a lead physician of Allied Physicians Group, Division of Telemedicine, a pediatric supergroup in New York. During the pandemic, Dr. Zilkha offered telemedicine visits to all of New York's children, including college-age students. She's also the mom to two grown children, ages 20 and 24. Welcome, Dr. Zilkha.
Thank you. I'm so glad to be here.
It's so exciting because we are here in person, we are both vaccinated, and we're in the same space. So I really appreciate you taking the long drive to be here and be here with all of the parents. So I want to talk to you about a pediatrician in general. So I think a lot of us parents, we think about a pediatrician and we think about our cute little babies and them going to get their immunizations and their well visits and their sick visits and the throat cultures and their physicals and all the things that bring our kids from birth to age 18. But once they turn 18, I think a lot of us don't really consider our pediatrician as part of their ongoing health care. So my question for you is, as far as your patient population, what is your experience with college students?
Well, currently my patient population is a little bit different than your average pediatrician because I do focus almost entirely on pediatric telemedicine, and there's certain things that you can't do, like the well check for the babies, the immunizations. I can't do that. So I was thinking about this question, and for the first 100 patients that I saw this month, I actually kept track so that I could have a better answer for you. And this month, 50% of my patients were under the age of 12, and then 50% of my patients were from 12 to 21 years. And of those, it was about half in college and half not in college. So it's actually a pretty decent percentage of my population that's in college.
And they are calling you themselves, or?
They're calling them, yes, they need to call me themselves because, as you know, once a child turns 18, unless there's a reason, medical legally, that you need to continue to be their guardian, they are in full charge of their medical decisions. And at college, it sometimes becomes an issue where parents think that they can just call the college, or they can call and make an appointment, or they can call the pediatrician back at home and have them call in something for their student. But that is not accurate. Once the student becomes 18, they're in charge of their medical decisions. And so as such, they need to make their own appointments and they need to attend their own appointments. Certainly, if they're in person, their parent is welcome to join them as long as it's okay with the student who is an adult.
So my question is this: a lot of us have experienced a telehealth visit during the pandemic. If you yourself have been to a telehealth visit, give me a like. I want to see if you've had a telemedicine visit. And telemedicine is great, but it has its limitations. I think we can all agree on that. So my question to you, Dr. Zilkha, is if someone's child is exhibiting symptoms of COVID, wouldn't it make sense for the parent to say, hey, go get a COVID test, as opposed to you might want to consider a telehealth visit because you would have to send them for a COVID test anyway?
It really depends on the situation. If the student definitely has COVID and is having any sort of respiratory distress, they will need to be seen in person. If it's just a question of, well, I may have gotten exposed at this party to someone's roommate who had COVID 2 weeks ago, that is something that it is much better to have a discussion with a physician before deciding what the next best step is. Even if they've known to definitely have an exposure, it also makes sense to discuss it with a physician, because it doesn't always make sense to say, oh, I was exposed at that party, so let me get tested for COVID tomorrow, or let me buy that rapid COVID test that I saw in Walgreens. I'm just gonna do that and then I'm gonna be okay. It's much better for them to have that discussion with us and for us to explain how COVID is transmitted, when you would be most likely to test positive even if you have no symptoms, or what to do if you have symptoms.
Yeah, and that makes a lot of sense. I mean, I remember last year when I thought my son was exposed. Well, he was actually exposed, and I was frantic, like a lunatic. And I guess, clearly someone who's a physician is not going to have that emotional attachment to the child and is freaking out. So that's probably good for them to hear from a physician, logically, rationally, and not as a mom.
It is one of the best things that I can do for my college students, whether it's COVID or not COVID, is to talk them down. A lot of times our college students and, adults that are way past college age, we get upset when there's something medically going wrong. But it's really helpful to have a trusted doctor that you can turn to that's in your phone and so easy to reach, that can help talk you down and calm you down, and then get to the point of, okay, well, what are we going to do next? And involve them actively in their medical care, which is the way it should be.
So I want to get into some parent questions. So I want to thank you, those of you who did reach out to me with questions. We had a lot of really good questions, and a lot of them did have similar themes. So I just picked some certain questions that I'm going to share with you. So my first question is from Florence in Connecticut. She writes, my son had a bad reaction to the vaccine. Does he really need a booster? So Dr. Zilkha, I'm going to kind of piggyback on that because this was one of the biggest things that we got questions about. If you could explain the booster, what is the booster? What is the difference between the booster and the vaccine? Would you expect similar side effects if your child got the first shot, second shot? If they got a booster, they're going to have the same reactions. Is the booster addressing this Delta variant? I know that I kind of just threw a lot at you, but
that's a lot of questions actually, and there's a lot to unpack there. So the first thing I would address for Florence is it really depends on what that reaction was. And there's really very, very few reactions that make the recommendation not to get a second dose of the vaccine. And really the biggest one would be a life-threatening allergic reaction. And I have not actually seen or heard of any cases of that, or I know in the literature it's been reported. But so that would be a life-threatening reaction to one of the vaccine components that might not even prevent them from getting a second dose. It might just prevent them from getting a second dose of the same brand of vaccine, because each vaccine, although some of them are similar, they do have different components, little tiny components called excipients in order to make them into the vaccine, and it can vary, and it does vary from vaccine to vaccine. In terms of the question of the word booster, I think we need to just talk a little bit about vocabulary. So when your children are little and they're babies, you know that you're going to be getting shots when you go there. So they're going to be getting immunizations, vaccinations, shots. In that situation, they're all used as synonyms. And we don't really use the word booster that much when we talk about the little babies. But in this case, in order to be fully vaccinated against COVID, you need 2 vaccinations. A vaccination and immunization in this scenario is identical. Booster is different. And shot is different. Obviously, you can have shots of other things in the English language. You can have a shot of whiskey, and that is not the same as getting a COVID shot. You can have a shot of steroids. You can have a shot of antibiotics. That's not the same thing as getting a COVID shot.
Or a shot of whiskey.
Right. In terms of the word booster, there actually is a meeting today at the CDC where they're addressing the concept of the booster and when the booster would be necessary and for what population. So honestly, that is going to be something that I may have a different view tomorrow. Just like I tell my patients that COVID is an evolving pandemic, and just because I had the best information a week ago and I told them something, I might have much better information the next week. I know it's frustrating for me as a pediatrician, as a mom, it's frustrating, and I know it's frustrating for my parents and my patients. But the question now about boosters is whether they're going to be recommended for the general population who has gone at least 8 months from the second dose of their completed series. What they're talking about now is a third shot for a certain very small subgroup of Americans who meet the criteria, who have severe illnesses that cause them to be immunocompromised, that would make them much less likely to have reacted as well to the first 2 vaccinations, and that's why they recommend that that small subgroup get a third one, and that is still considered part of the initial vaccination.
So right now, I think what you're saying is a healthy college-age student should not be thinking about getting the third shot.
Right now, I don't believe that they would be able to get the third shot.
Okay, so it kind of alarms me when my physician or a physician is not really sure of what's going on, right? Because of the ever-changing science or whatever you want to call it. So actually, we do have a question. I want to just jump to that just for a minute. Okay, that was from Laura in DC. And Laura asked, can you suggest a website for reliable info? Because it's changing so much, and a lot of times I'll go on my phone and I see all this information, I'm confused, and I really don't know what is right, and I don't know who to call or what website to visit. Could you have any suggestions on websites?
I have a suggestion about a few websites. The first one would be cdc.gov. That's what I went on this morning before this live so I could check that I was up to the minute, ready for information for you. And that's when I found out about this meeting that's happening today about the booster recommendations. But the cdc.gov website has many different parts of it that are geared towards lay people and many FAQs, and it was really pretty well written out. They also have sections that are more geared towards medical professionals, and I really wouldn't necessarily recommend you reading those. I read those. I actually print them out. I highlight them. I put Post-its on them because they are, even for somebody who deals with this every day, sometimes a lot. But they have excellent section for the general public. Other websites that I'd recommend are the American Academy of Pediatrics, which is AAP.org, the American Medical Association, which is AMA.org, and then since every state has different recommendations, I recommend you looking at your own state's Department of Health website.
Yeah, that's a really great idea because we do have all different states and they have all different rules.
Yes.
And they have all different websites, so that's definitely...
There's not one
yes.
site where you can get everything, at least that I need. So I have to go to multiple different sites, but those are sites that I trust for my information.
Thank you for that. So we have another question from Hannah in California. She asked, what about the long-term effects of the vaccine? So of course, as a mom, you're a mom too. I do worry about that, and probably a lot of you worry about that as well. What do you say to that? What are the long-term effects? Well, how do we even know it's such a new thing?
Here's the thing. I have been a pediatrician for almost 30 years. And in that time, I have seen new vaccines be developed. I've seen 2 new vaccines that were developed that when I read about them before I gave them to any patients, and I never actually gave them to any patients, I like to read a lot and study a lot before I will give a new vaccine to a patient or get a new vaccine myself. And these 2 vaccines I didn't feel comfortable with, and they were removed from the market within 3 months, and those vaccines never came back. Those vaccines had immediate side effects. They were not lifetime side effects, but they were immediate side effects that were bad enough to take them off the market. In all my years, I've never seen a long-term effect from vaccine. I have seen plenty of long-term effects from diseases. And that's what you see all the time. There are long-term effects from medications that were thought to be safe and were pulled. For example, Zantac is a medication I used to take for my stomach. It was pulled about 2-ish years off the market, and that was found to have long-term negative consequences. But vaccines, in my experience, have not been found to have long-term consequences ever. Sometimes they have immediate consequences, but long-term consequences, no. And I'm much more worried, much more worried about the long-term consequences of COVID, even asymptomatic COVID, even very barely symptomatic COVID. I'm very worried about the long-term effects of that. I know that we have patients in our practice who are 18, 19 years old, who've gone on now, it's been a year and a half, to have long COVID, very debilitating. I know many adults who have long-term COVID who were, to quote one of them, an Energizer bunny pre-COVID and now can barely walk across the room. So I'm much more worried about that.
Okay. Everything's very stressful.
It is. It's really stressful.
It is. So let me dive into Steve's question from Florida. He says, what are some things parents can do to support mental health while our student is at school? Clearly, this is a big problem. The question is, Dr. Zilkha, you as a pediatrician, are you able to address the mental health issues of the kids, or is that something that requires a mental health clinician?
So the good news from my perspective is that I am able to help my patients with their mental health conditions. Historically, pediatricians have not been the main ones to deal with mental health conditions. However, the pandemic has caused even a greater lack of mental health professionals versus our young adults that need them. And for example, I took a course given by the New York State Department of Health that was meant to train our general practitioners in how to take care of the mental health needs of our patients who aren't able to get it in any other way. It helped me tremendously to feel more confident, and it also helps me to have something else to tell my college students besides just ask me questions about COVID. Come talk to me about what's going on with your mental health. Let's decide together if maybe you want to have one telemedicine visit a week with me, that's totally an option. Or if I feel like they need to have something else, then I can talk to them about it. So that has become a very large portion of my telemedicine practice in the past few months, and I think it will become greater as time goes on.
And while we're kind of wrapping this up and getting, closer to the time we need to end, I want to talk to you a little bit about risk mitigation. And I know that my own college student doesn't like to listen to me very much, but maybe he'll listen to a pediatrician, a doctor. The college students, so they are in dorms and they are together, and whether or not they're vaccinated, they're not social distancing and doing all these things, even if they're wearing masks inside the classroom. I mean, I try and tell him, please, if you are going out to eat outside, please eat outside, begging him to eat outside. So there are certain things like that they can do, but how can we as parents kind of impress upon them to make better choices, the college kids, when my kids are not listening to me?
Yeah, this is really difficult, and I think it really comes down to empowering our children to let them understand that they are in control of their health decisions. It's not what mommy wants you to do. It's what you want to do and what you need to understand is the best choice. So I know, especially since students who were freshmen last year, they didn't get at all the normal freshman experience. And now, so we have two groups of students that are coming in and really wanting to get to those parties that they didn't get to last year. And my biggest advice is to really try to stay smart. And if you're gonna, even if everybody's vaccinated, we are seeing breakthrough cases, and I really recommend against those huge events where people might be drinking, which decreases their ability to make good decisions. And I really recommend that they try to mask as much as possible when they're going to be in large groups, even if those large groups are vaccinated.
So as we're wrapping up, can you just let us know what you would like our biggest takeaway to be from this about COVID, about the boosters, about telemedicine, and all that?
Sure. So the biggest thing I would like you to take away from this live is that you as a parent, although you don't have any decision-making powers over your 18 and above child, but you can empower them and assist them with how to make a telemedicine appointment from the safety of their dorm room or on campus. And if your pediatrician offers telemedicine and you don't know how to use it, figure it out, and then talk to them about it, get them to download whatever app it is on their phone, and just walk them through so that when they're ready, they don't have to freak out. They know it's just press this button, and then we will get a visit with our pediatrician. If your pediatrician does not offer telemedicine, there are large companies throughout the United States that offer telemedicine visits to 18 years old and up, and even younger, but I'm just thinking about our college students, and you can find out which one of these companies your insurance company covers. Most insurances will cover free telemedicine visits through one of these large companies. And so if you do your research, and again, you can help them get the app, figure out how to download it, and get it ready to roll if they have a question. So will have some feeling of mastery over their ability to get a medical appointment and a medical opinion on their own.
Well, I am definitely going to have this conversation with my son later. We actually have a telephone date this afternoon after his classes, so I'll make sure that he is aware of how to get in touch with a telemedicine doctor. I think that's a great suggestion, Dr. Zilkha. Thank you so much. Thank you so much for being here and sharing with us. I hope you guys visit CollegiateParent.com because we are here to support you on your entire college journey. And again, Dr. Zilkha, thank you so much. We hope everyone stays safe out there and be healthy. And I'm Shari from Collegiate Parent, and I'll see you next time on Facebook Live. Bye.